अस्सलाम वालेकुम सर, काइंडली स्टार्ट कर दें।
Okay, thank you. Let me share my screen again. Just give me a minute. Okay. Is it visible to you guys?
यस सर, विजिबल।
Yes, sir.
Great. Okay. So, benefits of HMAs. Implementing an HMAs provides you numerous benefits, including faster patient registration and reduced waiting times, improved accuracy of the patient records, better coordination between departments. So, what does it mean? So, in the hospital, if a patient visit on a general physician and the general physician give them some prescription, and then he will advise him to go between the departments. One department can refer to that patient to another department, and on the other department, that department can see the history of the patient and what are the things given to that patient, and according to that, or what are the recommendation advised by that previous doctor. On the basis of that, the skin specialist or any specialist on which the patient is referred can give can understand the things which is primarily diagnosed by the that general physician. So on the basis of that, the number one thing, it will reduce the time of the doctor, the specialist, and also it will intelligently routing into the system, and we have the all the journey of the patient, that from where department to where which department the patient is referred, and what are the treatments given at this department. So this is the internal coordination between departments on the patient journey. Also, you can refer to that patient to the other hospitals as well. For example, if your health facility or if your hospital have not access to that facilities or that machines, you don't have in your hospital, so you can refer to that particular health facility. For example, your hospital is not providing the CT scan or the X-ray facility, so you can refer that patient to the other hospital with the recommendation of that specific X-ray or that specific studies, and the patient visited that hospital. The hospital has already that record of that patient, which is sent by your organization or your hospital, and on the basis of that, they can give, or they can give them, or they can give the facilities to that patient. So, increase productivity of healthcare professionals. So, it will increase the productivity of the professionals, reduction in medical and administrative errors, efficient resource planning and utilization, enhanced financial transparency, better inventory control and reduced wastage, improved patient safety and continuity of the care, real-time monitoring of hospital performance, that which hospitals are performing well and which are below the parameter of the performance evaluation. So the you can or the higher authorities can take decision on the basis of that reports, that what how we can improve that. So our main motive is to improve the service delivery to the patients. NHMES serves multiple stakeholders, including hospital administration, doctors and consultants, nurses. So these are all the stakeholders of NHMES system. The pharmacists, and the laboratory technician, radiologists, reception staff, billing officers, finance department, inventory managers, human resource department, patients, insurance companies, and government health authorities. So, uh, typically, HMA's workflow is patient visit the patient session. Is I'm audible to you guys?
Yes, sir, audible.
All right, great. So then the appointment booking, doctor consultation, diagnostic test, lab radiology, CT scans, uh, prescription generations, pharmacy dispensing, admissions of the patient in the IPD or in the emergency, treatment and nursing care, follow-up appointments, and reporting and analysis. So these are the typical HMS flow, which is in any HMS system. Important importance in modern healthcare. Modern hospitals generate vast amount of clinical and operational data every day. And HMS translates data into the meaningful information with healthcare centralized access to the patient information. With advancement in the healthcare technology, modern HMS platform also
So there's a
integrated
slight
with
disruption. There's a slight
electronic
disruption in your
health
voice.
records, report information. So, okay. So you forcefully mute all the participants, right? All right. So in the laboratory information system, all right. Is I'm audible now?
So you are audible, but
जी आप
sometimes there's
बेहतर है
disruption in
जी
your
आप
voice.
बेहतर है
Okay. Great. Okay, so the laboratory information system is integrated with the HMES system. So whenever the machines generate the results, so that is automatically inserted into the HMES system. So the report is generated automatically. Then there is a person who will evaluate that reports and that these are corrected. So the person approved that reports, and then once it is approved, it is notified to the patient as well as the hospital doctors. So there are different kind of reports. For example, the urgency of the report. So is there any urgency that doctor notified that whenever the report is generated, give me a notification or give me notify. So whenever the report is generated so and there is no person at that time which can approve that report, but if the doctor mentioned that notify me whenever the report is generated, so automatically system will notify that doctor that the report is generated and these are the results parameters. So on the basis of that, the doctor can take the decision on the minimum time, so that if there is any emergency, uh, like that, we have to give the uh, we have to take the decision on that particular patient. So on these things, the doctor can get the help from this system as well. Then a radiology information system, archiving and communication system, PACS module, pharmacy information system, health information exchanges to exchange the data between the different health organizations, and then the mobile applications for the patients that the patient can see their journey or their history, have all the records of their medical history in that telemedicine platforms. So the patients can book an appointment with the doctor at their home, and at that time, they will connect it with each other through the telemedicine platform. And if there is no physical checkup required, then the doctor just prescribe the medicine into the system, and that will be visible to the patient on the mobile app. And the patient can go to the any pharmacy, show that prescription to the pharmacist, and get the medicine from there. And then AI-based clinical decision support systems. So the this is the thing which I was talking about to you previously, that now the systems are going to be intelligent. They can take the decisions, but this is just for helping the doctor, not the final advice. This is just to diagnose the things in that patient, or anything in the previous history. For example, there are the 20 or 25 history visits of the patient, and in some visit there is mentioned that the patient have allergy with that particular medicine or with that particular salt. So for the doctor can't see that 25 visit at that time, because there is a lot of patients at the health facility, and doctor have no time to check that. So at this point, the AI-based system will tell the doctor if the doctor is going to prescribe that medicine to that patient. So the system automatically alert them that this patient have the allergy issue with this medicine or with this salt in the previous visit at this time. So by that way, the doctor can take the decision that if he or she advise that medicine to that patient or not. So this will help the doctors that to give the better than IoT-enabled medical devices. So nowadays, the devices are also intelligent. For example, there are the machines, the blood pressure machines, they are the sugar machines by which you take that will generate the results, and these results automatically integrated into these machines are automatically integrated into your HMA system, and the result is entered to the system according to that test with that patient. So these are the IoT-enabled medical devices. Now, on the conclusion side, a hospital management information system is a digital backbone of a healthcare institutions. By integrating clinical, administrative, financial, and operational processes into a unified platform. So HMAs enhance the quality of the patient care, improves hospital efficiency, reduces cost, enable data-driven healthcare management. As healthcare continues to evolve, HMAs plays a critical role in supporting digital transformation and delivering safe, efficient, and patient-centered care. So this is that why we have the HMAS system, what is the HMAS system, and what we are going to do in that system. So if you guys have any question, please let me know. Otherwise, we will move forward for the practical demonstration. The system which is implemented into the Punjab hospitals. So the admin, can you please allow the participants? So if they have any question, they can ask.
Okay, sir. Yeah.
Okay, so is I'm audible now? The admin, you muted me forcefully. Uh, yes, Dr. Kamal.
Assalamualaikum, sir.
Walaikum Assalam.
Sir, my name is Dr. Kamal. I'm from Gangaram Hospital. सर आपने ये जो चीज़ें सारी मेंशन की है कि इसके एक प्लेटफॉर्म के ऊपर हम फाइनेंशियल एडमिन और क्लिनिकल चीज़ों को हम एक साथ इकट्ठा जो है वो पाइल अप कर लेते हैं। मैंने इसको प्रैक्टिकली भी हमने देखा है, अच्छा सिस्टम है। अच्छा सर, इसमें एक चीज़ ऐड करनी है, वो ये है कि एमएलसी जैसे मेडिको लीगल केसेस हैं, ये आजकल
Yes.
काफी इम्पोर्टेंट है और बड़ा एक आजकल आपको पता है हर प्लेटफॉर्म पे इसकी बात होती है। मेरी सजेशन ये है कि हमें उनको भी इसके अंदर जो है वो ऐड करना चाहिए, ताकि जब भी किसी पे तो वन क्लिक अवे जो है वो हमें डाटा जो है वो हर तरफ असेसिबल हो। जैसे आज मैं गंगाराम हूँ, कल मैं जिन्ना हूँ, परसों मैं किसी और हॉस्पिटल में हूँ, तो मुझे ये ना हो कि मुझे बैकलॉग में जाना पड़े, देखना पड़े, मैनुअल काम ना करना पड़े।
Okay, so Dr. Kamal, the Gangaram Hospital actually is under the specialized healthcare, right? So in our
जी
system,
सर।
yes. So in our system, we which is running in the DHQ and THQ, we have already integrated the MLC system, and it is already running from the day one into the hospitals. So actually, there is the management level. There is one thing. Here in Punjab, there are two or three different systems are running into the hospitals. So that is a question mark. And we are communicating with our seniors as well, the administration, the policymakers, that there should be the one system in all over the Punjab, so that we can give all the facilities or all the modules to all the hospitals. So they are in the collaboration with us as well, the specialized healthcares as well. So hopefully they will integrate their system with our system, and we will provide the facility of the MLC to them as well. So in our system, there is already the MLCs, and I will show you that as well in the demonstration.
सर कई दफा कनेक्टिविटी का भी बहुत इशू आता है HMIS में ना, उस वजह से फिर कभी मैनुअल पर्ची बनती है, कभी पेशेंट का HMIS पे आ रहा होता है। इसके बारे में भी फैसिलिटेशंस होनी चाहिए।
Exactly. Actually, the same. We have there are two different. One is developed by the specialized healthcare, and one is developed by the Health and Population Department. So the specialized system is only working in the online. So if there is no internet, then you have to move on to the of you have to move on to the manual prescriptions and the manual registrations. In our system, we have given the facility of two different things. One is the online and one is the offline. So if there is no internet, you can use the system. So there is no effect on the hospital operations. And when the internet is back, all the data is synced back to the centralized system. So I hope they will adopt that as well, because their representative is not in this meeting, so they can give you their point of view. Any other question?
जी सर, उस्मान साहब, बहुत अच्छा लेक्चर था जो कि हमारे हॉस्पिटल्स में हम सिस्टम चला रहे हैं उसको। मोस्टली अब तो काफ़ी इस पे आ चुके हैं हम लोग इस सिस्टम के ऊपर, और अब काफ़ी ट्रेंड भी हो चुके हैं। तो लेकिन उसके लिए जो और किसी को कोई क्वेश्चन पूछना हो, पार्टिसिपेंट्स से रिक्वेस्ट है कि अगर कोई क्वेश्चन पूछना चाहें।
मैडम क्वेश्चन एक था, बट सर ने क्लियर कर दिया है, क्योंकि जो हमारा स्पेशलाइज्ड है, ही सेड कि अभी उसमें HMIS पुलिस स्टैब्लिश नहीं है, वो दे आर कनेक्टिंग, क्योंकि इन्होंने कहा कि ड्यूरिंग डिजास्टर जो है वो 3 बेड्स 3 पेशेंट्स ऑन अ बेड जो है दैट कैन बी अकोमोडेटेड। लेकिन हमारे यहाँ पे जैसे कि गंगाराम से फिर मैं डीएमएस एडमिन हूँ डॉक्टर नायाब, यहाँ पे तो गायनी के बिकॉज नो रिफ्यूजल पॉलिसी है, और यस शॉर्ट ऑफ रिसोर्सेज भी हैं, और एवरीथिंग इज फ्री। तो इस सारी वजूहात की वजह से जो पेशेंट है गायनी के बहुत ज्यादा होते हैं, और नॉर्मल जी जी नॉर्मल सर्कमस्टांसिस में वी हैव टू अकोमोडेट लाइक 2 to 3 पेशेंट्स जब हमारी इमरजेंसी होती है वार्ड्स के अंदर। तो बस इस सिलसिले में पूछना था, बट
डॉक्टर
देन ही क्लियर कि HMIS इज नॉट फुली एस्टेब्लिश नाउ अभी स्पेशलाइज में। तो
Dr. Fatman, can you mute your mic? Yes. So, Dr. Niab, actually, you are right. So there is I said that there is a limitation on the government side as well, that we have the limitation of resources. So the workload or the patient load is so much, so we have to cover them by that way that we put the multiple patients on a single bed, and which is actually not the standard of the medical industry, but due to the limitation of the resources, we have to do that.
सर अस्सलाम वालेकुम।
वालेकुम अस्सलाम।
सर एक क्वेश्चन पूछना था, डॉक्टर माहिद बात कर रहा हूँ शादरा हॉस्पिटल से। सर
Yes,
अक्सर
please.
हमारे पास डॉक्टर्स जनरल ड्यूटी पे अपॉइंट किए जाते हैं किसी और हॉस्पिटल से, मोस्टली कंसल्टेंट्स। तो उनके साथ पेशेंट एंटर करने में HMIS में मेरी एक सजेशन थी, कोई रिलैक्सेशन होनी चाहिए। जैसे अगर कोई किला गुज्जर सिंह में अपॉइंटेड है ओरिजिनल प्लेस ऑफ पोस्टिंग में, अगर हमारे पास 3 दिन के लिए वो जनरल ड्यूटी पे आ रहा है, तो अपने पेशेंट्स हमारी हॉस्पिटल फैसिलिटी में एंटर नहीं कर पाता। वो अगर एंट्री करेगा तो किला गुज्जर सिंह में ही उसकी एंट्री होगी सर।
ओके,
इसके
सो
बारे में कोई गाइडेंस चाहिए।
जी, आप अभी HMA सिस्टम कौन सा यूज कर रहे हैं, इस स्पेशलाइज्ड हेल्थ केयर का और द हेल्थ एंड
सर
पॉपुलेशन
प्राइमरी
डिपार्टमेंट?
सेकेंडरी का, हेल्थ एंड
प्राइमरी
पॉपुलेशन
सेकेंडरी
का।
का। जी, हमारे सिस्टम में ना हमारे सिस्टम में एक प्रिविलेज है, जिसमें आपके कोई भी डॉक्टर किसी दूसरी जगह पे ट्रांसफर होते हैं जितने डेज के लिए होते हैं, तो हमारे यहाँ पे एक सीनियर डाटा प्रोसेसिंग यूनिट सेल है, जिसमें लोग बैठे हुए हैं। आपके जो MS हैं या DMS हैं, वो उनको रिक्वेस्ट करेंगे कि ये डॉक्टर हमारे पास शिफ्ट हो गया है फॉर दीज डेज, ठीक है, तो वो उसको अलाउ कर देंगे उस हॉस्पिटल के लिए रजिस्ट्रेशन और द प्रिस्क्रिप्शन, ठीक है, तो फॉर दैट पर्टिकुलर टाइम पीरियड। अगर वो कम्युनिकेशन गैप है और वो वहां पे बताते नहीं है, तो देन द सिस्टम विल नो कि भाई ये डॉक्टर कहाँ से कहाँ पे शिफ्ट हो रहा है, क्यों हो रहा है। सो सिस्टम को हमें बताना पड़ेगा किसी पर्सन को, तो ये एडमिनिस्ट्रेटिव मैनेजमेंट का रोल है इसमें। तो अगर वो ये चीजें नहीं बता रहे या वो ये चीजें हैंडल नहीं कर रहे, तो देयर इज अ लैक ऑन देयर साइड।
राइट सर, थैंक यू।
ओके, सो कैन वी मूव फॉरवर्ड? All right. So there is one more thing we have to cover in this presentation or in this session, that the issues we faced during the implementation of the HMA system. So there are the multiple issues that we have to face, which is related to the network structure, which is related to the human resources, which is related to the data entry operators. So there are the data entry operators which are entering the data wrongly, which is not good. In any case, in any way, that is not good. If you are not taking the purpose of the system is to collect the data of the patients accurately and give them the purely cleanly way the medications and the prescriptions and all the things. And so if I don't have the correct data of the patient, I cannot give them the medicines, or if the government is going to plan to deliver the medicine at their home, so we can't do that. Or if we don't have the correct information of the patients, we can't claim the insurance of that patient as well. So this is the issues we are facing in the data entry side. Also the adoption of the system. So the peoples which are working manually, they are not ready to shift on that system, which is completely a wrong thing, because every industry is evolving with the IT. We have to shift, we have to adopt that shift, and we have to make the system improve day by day. So you guys are the stakeholders. You have to tell us that these are the things, these are the deficiencies which we have to cover in the system as well. So with the mutual communication, we can improve the systems as well. Then there is the issue with the infrastructure level that is not in our controls. That is the internet is down. So what we can do is we can give the offline version of the system as well, so that there is no operation stopped or halt due to that disaster. And then there is one thing which I find out into the real-time scenarios, that there are the doctors which have no experience with the systems, with the typings. They have slow typing speeds, and they feel that it is second job to us to enter that data. And so for that, this is I can understand their issue as well, that their duty will be increased. They are looking to one patient and they are going to enter the information into the system, and this will increase their time to the patient service. So we are going to improve that in the coming days with integration of the AI, so that the doctor can only speak to the system, and all the things all will be written into the system as well. The doctor can look into this and submit the information for that particular patient. And also the system will give their advice on that as well. So that will be generated by the AI. Doctor can verify that and just submit that. So it will reduce the doctor effort and the doctor time as well. So we are going to implement that in the coming days, but it will take some time to be go on live, because for that we need some infrastructure which it will be provided by our management. So when they will arrange that after the approval of the procurement process, so we will live that system as well for the ease of the doctors. So this is the conclusion and the end of this session presentation. Uh, if there is anything, please let me know.
Any other question from the participants?
नो मैडम।
सर अभी हमारे पास 8 मिनट हैं इस लिंक को खत्म होने में, तो अगर कोई करना चाहता है
Okay.
तो ठीक है, नहीं तो फिर थैंक यू सो मच।
Okay. And madam, I have few questions. So, is all of the doctors are currently using some HMES system in their health facilities?
मोस्टली तो लोग इस पे काम कर रहे हैं, लेकिन कुछ ऐसी होता है कि किसी कोई ऐसा जगह हो जहाँ ये ना चल रहा हो, लेकिन जो इस ग्रुप में है, इस ग्रुप में टीचिंग हॉस्पिटल के ही लोग हैं और वो इस पे काम कर रहे हैं। अगर कोई नहीं कर
Okay.
रहा तो काइंडली बताएं।
Okay. Okay. So, madam, what I actually want from them as well. Uh, can you schedule the sessions, one session in a month on that, so that we can take the input from the doctors and from the staff of the hospitals to improve to improve the system, so that it will be good for the doctors, for the stakeholders, as well as for the development software side as well. So what do you think about that?
थैंक यू सो मच सर। आपका ये बहुत अच्छा है कि जी हमें फीडबैक मिलता रहेगा। और अभी तो ये स्टाफ कॉलेज का क्योंकि शेड्यूल है, लेकिन मैं कोशिश करूंगी कि इसको डिस्कस करते हैं और हमारे जो
Sure.
Sir, your voice is not clear actually.
पार्टिसिपेंट्स भी जो हमारे हैं इनका भी फीडबैक ले लेते हैं हम, क्योंकि ये बहुत अच्छा होगा कि आपस में म्यूचुअल डिस्कशन हो, और अगर एचआईएमएस में किसी को अंडरस्टैंडिंग या कोई प्रॉब्लम्स आ रहे हैं तो वो डिस्कस होते रहें।
Right. Exactly.
हम्म, सर मेरे ख्याल में अभी पार्टिसिपेंट्स कोई करना चाहता है क्वेश्चन?
No, ma'am, thank you so much.
एक सर प्रैक्टिकल इशू है जो कि मुझे फेस करने को मिला है जिना हॉस्पिटल में, कि जब
जी जी।
पेशेंट आता है और अब इमरजेंसी काउंटर के ऊपर, तो वो आके अपनी स्लिप बनवा के वो मेडिकल इमरजेंसी या सर्जिकल इमरजेंसी में चला जाता है। तो वहां जाके तो उनको डॉक्टर्स कहते हैं जाके मेडिसिन लेके आए। वहां पे सिस्टम डाउन हो गया और वहां पे लाइन लग जाती है, जिसकी वजह से बड़ा इशू बनता है। लोग जो है वो इस चीज को एक्सेप्ट नहीं करते ना, कि पहले हर जगह से एक
Exactly.
टीका भी लेना है तो जी एंट्री करा के लाओ, एक कैप्सूल भी लेना है तो एंट्री करवा के लाओ। तो सर थोड़ा सा इस तरफ भी रुझान हो कि पेशेंट एजुकेशन के ऊपर भी थोड़ा सा इस चीज को एम्फसाइज किया जाए, कि लोगों को पता लगे कि अब हर चीज डिजिटल है, पेपरलेस जो
बिल्कुल।
है काम है। ये थोड़ा सा एक लैग आता है जिसपे काफी दफा डॉक्टर्स और पेशेंट्स की आपस में बहस व मुबासा भी होता है, और काफी क्रिटिकल सिचुएशंस भी हो जाती है।
Yes, I totally agree with you on that. We also, I was when we are implementing our system into the hospitals, I was there practically, and I was observing that scenarios. So by understanding that scenarios, we take our system to the offline module as well. And in the Jinnah hospital, the system is actually the online, which is developed by the PITB, and there is the limitation on that system right now. But I will discuss that thing with my senior management and with the secretary health as well, so that we will take some decision on that if they have to discuss with their seniors as well. So there might be we can do something on that as well.
ओके सर, थैंक यू।
थैंक यू उस्मान साहब। इंशाल्लाह अगर कोई और क्वेश्चन हुआ या किसी कोई पार्टिसिपेंट ने कहा तो मैं आपसे कम्युनिकेट करूंगी। आपका बहुत शुक्रिया कि हमारे लिए ये एक बहुत ही इम्पोर्टेंट टॉपिक भी है, और हमारे लिए ये एक बहुत ही इम्पोर्टेंट जो हमारी वर्किंग है उसके लिए ज़रूरी है। अब मेरा ख्याल है कि जी तमाम पार्टिसिपेंट्स को इसको देखना चाहिए और इसको सीखना भी चाहिए, अगर कोई नहीं सीखा हुआ। अदरवाइज हमें देखना तो मतलब करना तो पड़ता है। तो अगर हम इसको जैसे कि इन्होंने हमें प्रेजेंटेशन में उस्मान साहब ने सारा बताया है, अगर हमें इसको स्टेप वाइज अगर हम कर लें तो हमारे लिए ये बहुत ज्यादा मुश्किल नहीं होगा। और ये
Yes.
क्वेश्चन लास्ट क्वेश्चन था, ये बिल्कुल है कि जी अगर आप पेपरलेस करना चाहते हो तो फिर अ, हमें पेशेंट्स को पर्ची पे नहीं रखना। पेशेंट्स को सिर्फ आपने टोकन देना है और वो अंदर जाएगा जब दूसरी जगह पर, तो वहां ही उसका सारा का सारा डाटा खुला होगा।
एग्जैक्टली अच्छा मैडम इसमें ना एक्चुअली मैं इसमें कुछ हेड अप करना चाहता हूँ
जी जी।
कि ये वाला जो सिनेरियो अभी डॉक्टर साहब ने बताया था, इन दिस सिनेरियो व्हाट यू कैन डू, बिकॉज वी वी कांट स्टॉप द सिस्टम। और अगर आप पेशेंट को ये कहेंगे जी सिस्टम अभी ऑफ है या डाउन है तो आपको मेडिसिन नहीं दे सकते, तो वो पेशेंट तो हाइपर होगा। ठीक है, तो हमें एक पेशेंट को एजुकेट करने की भी जरूरत है। दूसरा, हमें अपना जो प्रोसेस है, वर्किंग प्रोसेस, उसको भी थोड़ा इम्प्रूव करने की जरूरत है।
हम्म।
इन दैट केस इफ द सिस्टम इज डाउन एंड देयर इज सम इशू, then there should be some mechanism that the doctor prescribe that medicine manually to that patient and stamp it on that paper, and the patient will go to the pharmacist, submit their prescription on the page, and take their medicine so that we can give timely medicine to the patients. And when the system is up again, the pharmacist's duty is to enter that medicine to the system. So we should improve that process as well, because अगर कोई भी फॉर एग्जांपल लेट्स सपोज अगर आप अपने आप को सपोज करें, आप एज ए पेशेंट जा रहे हैं अपने, आप किसी पेशेंट को अपने लेके जा रहे हैं और उसको मैं कह दूं कि भाई ये मेडिसिन लेके आओ, और उसको वो मेडिसिन ना मिले उस फार्मेसी से या उस जगह से, तो वो हाइपर होगा, वो लड़ेगा। तो इस चीज को हमें मैन्युअली सॉर्टेड आउट करना चाहिए, क्योंकि सिस्टम के अंदर ये लिमिटेशन है उस जगह पे, आई नो डैट, बट दीज थिंग्स नीड टू बी डिस्कस with the higher management to the persons which are the stakeholders or which are the owners of that product. तो ये अगर उन तक बात, आई विल ट्राई माई बेस्ट टू रीच दैट
अच्छा
पॉइंट टू
सर,
दैट।
सॉरी सर, मैं आपको डिस्ट्रैक्ट कर रहा हूँ। सर आपका आइडिया ज़बरदस्त है, और अक्सर हमारे साथ ये होता है, सिस्टम डाउन होता है और पेशेंट हाइपर होते हैं, और हम डेली बेसिस पे ये सिनेरियो फेस करते हैं। और जब हम मैनुअल को मेडिसिन लिख देते हैं तो वो हमारे लिए ही दर्द सर बन जाती है।
ओके, इन विच वे वो आपके लिए क्यों दर्द सर बनती है फिर?